Comparing the cost of healthcare between hospitals just became a little bit easier.
A new federal database now gives people the ability to look up how much they can expect to pay at different hospitals. News 8's Carrie Vick joins us with a breakdown of how our local hospitals stack up.
The new federal data from the Centers for Medicare and Medicaid Services gathered Medicare payments from thousands of hospitals in the U.S. for some of the most common treatments. It found hospital charges for the same treatment can vary widely, but here in La Crosse, it's a different story.
Local health leaders say the new federal data allowing people to compare prices between hospitals for the same treatment is a step in the right direction.
It's a good thing. It's absolutely a good thing.
This is a good thing to have this available.
While costs across the nation vary widely, Mayo Clinic Health System and Gunderson Health System have relatively similar rates. For example, inpatient psychiatric treatment costs just more than $15,000 at Mayo. At Gunderson, the price tag was almost $18,000. For heart failure treatment, Mayo costs about $18,000 and Gunderson cost about $17,000. They're prices that also fall below the national average. And while leaders at both hospitals like the new tool, they say it does have its shortfalls.
The thing that's missing is the severity of illness within that. So, for example, if you have, there's maybe 10 cases in a particular category, they're not all the same. And so some cases might have had more severe symptoms than others. So there's just some variability in those prices that we have to be aware of.
I'd point out that charges are really only a part of the story. There's at least 3 other key variables that come into play in the determination of healthcare value. First of all, quality and outcomes.
While the federal data is new to many areas of the country, Wisconsin already has tools for residents to compare prices that could be even more accurate.
If you go to the Wisconsin Hospital Association price point, which is a representative of all patients, remember this is just the Medicare patients, which is a subset of all the patients, you'll see less variability in prices between hospitals in Wisconsin than what showed up in that report.
The theme here is transparency. Wisconsin price point, I think, is a great example of the state of mind in Wisconsin.
Now, while Gunderson Health System and Mayo Clinic Health System were pretty similar in most rates, there are some treatments that have larger discrepancies. For example, a major small and large bowel procedure at the 2 hospitals has about a $58,000 difference in cost.
All right, thank you, Carrie. If you'd like to take a look at costs of all the different treatments, you can find a link to the data on our website at news8000.com.